Hi, it's Lee Brandon here, Injury Rehab Specialist. Now, wouldn't it be great if you could wake up every day, your lower back felt amazing and you could do whatever you wanted to do without any limitations or restrictions? Well, in today's video, I'm going to be discussing facet joint pain and what causes facet joint pain. It's important to understand what causes your problems because quite often you need to eradicate the cause to overcome the pain and be able to live a normal life without the pain. So the facet joints themselves, if I quickly show you my model Rodney here. Now, hopefully you can see here in between each section where the vertebral bodies join each other, they're what's known as facet joints. Okay. So the facet joints, they restrict movement in the spine. They also help to dissipate load through the spine, help keep the spine nice and healthy. Now, in my experience, what tends to be the most common cause of a facet joint injury, so if you look at the lumbar spine here, now when you go into extension of the lumbar spine, those facet joints now, they enclose down on each other, so there's much more limitation in the amount of movement people can get in side flexion and rotation. So now it's not necessarily just static posture, i.e. when they're standing, but also it could be when they're moving as well. So someone might have normal posture in the lumbar spine, but as soon as they start to run, they might have the inability to stabilize their pelvis. So if their lower abdominal muscles, for instance, aren't functioning properly, what you'll get is the pelvis will actually tilt forwards too much when they're running, and that will create the same issue with the facet joints. So the facet joints will close down on each other, will become a much smaller space, and again will limit the amount of side flexion and rotation they can get. So again, if you imagine the average person does about 10,000 steps per day, and if they're exercising, they're going to be putting a lot more load through the spine. So each day they might not cause a lot of problem, but if you think about day in, day out, week in, week out, year in, year out, eventually over time, as someone's moving throughout a day, those facet joints are kind of hitting each other. So whilst they're designed to be able to cope with a certain amount of stress, they're not really designed to cope with excessive stress on a regular basis. So what can happen is you can either get like a cyst in the joint, or the joint just gets inflamed and painful. Now, in addition to that, what can also happen is there's a part of the spine called the pars articularis. So I don't know if you can quite see, it's just in there. Now what can happen is that can become fractured, and that's what's called a spondylolysis. And if it gets a lot worse, it can become a spondylolisthesis and actually have a complete break, and then one of the segments of the spine generally shifts forwards. So the symptoms will be relatively similar for all three of those, and the things that make it worse will be the same, which is generally extension of the spine. So what I'm going to do in a future video is I'm going to show you what kind of things you can do to overcome those types of injuries. So make sure you subscribe to the Bodycheck YouTube channel, like the Bodycheck Facebook page, and I look forward to catching up with you soon in a future video. Bye for now.